Welcome to Health Authority TV. I am Janan Sarwar, the new deputy editor for Health Authority Books. It's a new partnership between Indie Books International and Global Bookshelves International. I'm excited to have a guest today, and his name is Dr. Delon Canterbury. He's a board certified geriatric pharmacist and the president and chief executive officer of GeriatRx Incorporated, which is located in Durham, North Carolina. He's a certified community pharmacogenomics consultant, PGX consultant, and he is known as the Deprescribing Pharmacist. Thank you so much for being here today. How are you doing?
Hey, Janan, it's so good to be here. I'm doing amazing. How are you?
I'm doing well. I can't believe it's been so long. We have known each other since pharmacy school back in North Carolina. I think
Yeah,
I was a year ahead of you at UNC. Is that
that's
right?
right. Yeah, bringing it back to our stomping grounds. That's right.
That's
Right.
right. That's right. Awesome. Well, I'm so glad to talk to you today and definitely want to let our viewers understand and learn more about who you actually serve as a health authority leader. So tell us more about that.
Definitely. I started geriatrics with really having our older adults in mind. This is a concierge wraparound service dedicated for the caregiver. So that is our prime person we are serving. And I'm tired of seeing people, particularly as some of our older adults, fall victim to the use of overuse of medications and treatments that lead to preventable harm and falls and side effects that really worsen quality of life. So we end up servicing the family. We are unhinged. We don't work for a pharmacy. We don't work for insurers. We don't work for pharmacies. We are all about the family and figuring out what matters most to you and how can we make sure we help you age gracefully at home or wherever your setting is that keeps you happy and healthy.
That is so interesting. Yeah, it's definitely cool. It's not what you think of when you think of a pharmacist, when especially as you're known as the deprescribing pharmacist, right? So
Right.
uh, to help a family or help someone that is in need of your services, which are, tell us what you actually do. What are the different services that you help that family member or the caregiver with?
Yeah, absolutely. So we will give you essentially 24/7 wraparound access to professional geriatric pharmacists focusing on reducing that med list. And we do it as soon as you need us. There isn't a long 3 to 6 month wait just to get a consultation. So we provide a virtual remote practice. We service anyone, anywhere in the world, right? We are all about giving you tools and advice virtually around med safety. So we can do one-on-one consultations. Additionally, we work with families over the course of 6 to 12 month times, really working with the full care team. So this includes correspondence with your doctors and prescribers, advocating for the family for some of those needs and issues that are coming up, performing pharmacogenomics or genetic testing consultations to make sure those meds are meshing with your body and how they may respond. We're doing this all in collaboration with our care managers, our care providers, and of course the patients. So we're really focused on bridging those gaps in our health systems and being that advocate that our caregivers really, really need.
Absolutely. And, is it just when you're consulting, does the patient just need to have their med list with them, or what kind of things do they need to have, or how does someone prepare to work with you?
Yeah, when people sign up with us, we have a pre-questionnaire form that's filled out, and it prompts them to list all the medications, all of the over-the-counter, all the supplements, all of the, medicated shampoos, you name it. But we want to know everything that's going in or around the body aimed to treat. And that includes, of course, our supplements and our vitamins. Additionally, we want to know all of the health conditions. So some of our clients will end up providing us their My Chart records, and we go in and we do more of a retrospective look back of what conditions are being managed chronically by their care team. Additionally, the most important thing, I think, the tool that we as clinicians have is our ears. It's just listening.
Yeah.
Listen to like what are the biggest issues. I get more information asking probing questions than a chart review. And I find that that gives me that timeline to go look backwards and figure out, okay, you've had this symptom for X amount of time. Maybe it was this drug change, or maybe it was the addition or removal of something that presented. So it's kind of like you're working backwards and you have those beautiful aha moments where you're like, oh, wow, I didn't think about that. And lo and behold, like we were just off the phone with a consult and it was just pinpointing the timeline and making it clear for people that, pharmacists can do so well.
Do you have another story or experience where you were really able to make an impact with a patient that you want to share or you remember?
Yeah, our very first client was this 70-year-old woman who was on 30 plus medications, right? She was presenting as if she had severe dementia. It
Yeah.
was pretty wild. And the daughter, the caregiver, was the one who looked out for us and hired us to do a med review. In doing that review, we found multiple drug interactions, multiple duplicate therapies, multiple allergy meds, and it explained why she called her a walking zombie,
Oh,
like
wow.
literally a walking zombie. And it was disheartening, but in this instance, we were able to not only do the med review, but collaborate directly with the doctors, get her from those 36 pills down to just 8 medications in just a couple of weeks' time. So it was such a significant change. I mean, this woman was just sitting in the chair, wasting away, not responsive, super confused, irritable. And all those symptoms vanished in just a couple of weeks of us tapering some of those problematic meds. And the best part about the story is the family was going to unfortunately force her into a nursing home or memory care home. We were able to curb that and get the jury of her peers to drop the involuntary committal because of our medication review and testimony. So that was my first time serving on the stand, presenting my actual review and proving, hey, here's where the issue is. This is not a natural decline. This is 8 or 9 meds causing the issue. And that just, wow, changed the way I felt as a pharmacist and as an advocate and as a clinician.
Oh my goodness. And is this like what is the cause of the issues? Where, I mean, is it, for the medication safety? Clearly, this is not good for the patient and they have
Mhm.
a healthcare team. Where are you seeing many of these errors or overprescribing potentially happening? Is it because of a root cause or polypharmacy or
Mhm.
yeah, what do you think?
No, it's a great question and it's a multifaceted answer
Yeah,
in a, as you know, circuitous health system.
yeah,
But ultimately, uh, we frankly don't use pharmacists in this light to fully deprescribe. I mean, let's be honest. I didn't even learn about deprescribing at UNC. Like,
right,
I learned about it after in the field working with older adults and eventually geriatricians. Doctors don't know about deprescribing unless you're a geriatrician or unless you're now it's becoming more of a commonly used term,
right,
but it's not taught. So there's already a gap. And then if there's any type of confusion, you're not going to act on it, right? As a clinician. So if I don't
right.
feel comfortable deprescribing, why would I bring it up unless I have an invested interest? And then additionally, time. This is a system that just isn't free of time. So the time for people to take an hour and a half consult and literally whittled into each and every dose and appropriate indication and use and timing, frequency. These are things that aren't traditionally done in our normal pharmacy setting. I mean, frankly, you're not getting an hour consult at Walgreens or CVS. That's never happened.
Right.
So it ends up going through the cracks, and then now we have a fall or a near miss or something that leads to the patient having worsened issues. And then we retrospectively say, oh, let's look at the meds now. That's the problem we have to fix in this system. And so let's just have proactive force multipliers deprescribe it in advance before we force you to a nursing home, before we, send you down that rabbit hole of adding more meds and more meds to treat something preventable. So that's the mission, but it's a number of reasons, lack of education, lack of integration of geriatric pharmacists. Only 1% of pharmacists are geriatric trained. So
Yeah.
again, there's just a lack in the training and expertise. And so I aim to evangelize and yeah, exponentiate that.
Yes, you do a great job speaking about it, whether it's on LinkedIn or other platforms. I know speaking at conferences, this is definitely something that has a lot of patient advocacy, and I'm glad that you're doing the work that you do. And speaking all of these about all of these gaps in the healthcare system, imagine I gave you a magic wand and you
Mhm.
know you have all this experience here in this industry. What would you do if you could redesign the healthcare system?
Well, I'll keep it to the lens of geriatric medicine,
Sure.
because there's a number of things
Yeah.
from a public health standpoint. But I think every family, as we start hitting our mid 50s and 60s, needs like just a designated navigator. You just need a care navigator, someone appointed to each family who can do a needs assessment and like make sure we're bridging any things in their 50s. So when they hit 60s and 70s, it's not too late to change the course, right? And so my magic wand, holistically speaking, better nutrition and better access to food sources that aren't rife with all these things that may lead to chronic concerns. And affordable care was be my magic wand. But all
Yes.
right, going into geriatric pharmacy, I think across the board, we just need pharmacists in tow with all types of prescribers, and we cannot be seen in this, afterthought light that we've traditionally been seen on. And we need to be a part of the decision making. And so we have this in rounding in hospitals and interdisciplinary teams, but it's like, why aren't we translating that to a higher volume? So I think it's not to take prescribing power, it's to just optimize prescribers' ability to choose the right thing at the right time. So having that embedded can mitigate so much harm, so much preventable care. It could streamline when people are being discharged from one hospital to an assisted living. And we just need people in place. And I think pharmacists are best for that. But I think everyone can talk about med safety in a positive light and just give people this reframing of what we once thought 60 years ago is no longer the case when it comes to our medications today. So a lot of magic wands there,
Yeah.
but I think they're all necessary.
No, you're absolutely right. I think that, you bring great perspective even from the way we can prevent and the way, outside of that hospital system, once a patient is on their own and their age is increasing and there's just so much more that's impacting them, setting them
Mhm.
up for success in a different way. I love your suggestion also of having that appointed person in each family that has that knowledge and wherewithal to take care of, especially those that are aging. So I
Mhm.
hope that we can take from this and, if people want to reach out to you or learn more about you, where do you want them to connect with you? What's the best way?
Yeah, our website is geriatrics.org, Geriatrx as an X-ray. We are on all social media, so follow us on YouTube or on Facebook. We're most active on LinkedIn. Feel free to send me a message. I'm, Delon Canterbury, or our page. Follow us at Geriatrics. But you can also just give us a call or text us. We're very accessible. So our mission is to serve.
That's amazing. Yes, I hope that you continue to help make impact and convince people of all the changes that we need to make slowly but surely. And again, I appreciate your time chatting with me today. And for those of you that are tuning in, until next time, may you all be healthy, wealthy, and wise. Thank you.